Hello, everybody. Hope you're all well and safe at this turbulent time. My name's Paul Jebb, and I'm a coordinator for the We Are Global Nurses movement in the UK. And I'd like to introduce my colleague, Jenny.
Hi everyone, my name is Jenny Watts. I'm a nurse in the UK, and with Paul I set up and we've developed a community of ICN members and supporters called We Are Global Nurses.
And we're joined today by Howard. If you want to introduce yourself, Howard.
Hi everyone, I'm Howard Catton. I'm a nurse and I'm the Chief Executive Officer of the International Council of Nurses.
And thank you for joining us, Howard, today to have this conversation and talk through some of the facts in relation to International Council of Nurses, the ICN. So we'll kick off. So Howard, do you want to talk us through what the impact of ICN is as an organisation and how you evaluate that impact?
Sure. I think that the first and most important thing to recognise is that ICN is the body that the World Health Organization recognises as being the global voice of nursing. We have a special relationship, but that sounds as though it's casual. It's not, it's very formal. We have a work plan that has to be renewed every 3 years, which says what it is that ICN are going to do to bring nursing to global health policy. And during that 3 years, and at the end of that 3 years, that is assessed by the WHO to see whether we've delivered, and it's dependent on their assessment that our status, our relationship is renewed. So what sort of things have we done? Hard technical and nursing advice into policy, guidance, primary healthcare, infection prevention control, workforce, patient safety, antimicrobial resistance, NCDs. I could go on to name but just a few. But it's not just WHO we work with the International Labour Organization, we work with the World Bank, we work with the United Nations. So across the international community, we're recognized as the global voice of nursing. But then we also, of course, provide very specific nursing practice and policy advice as well. You'll have seen our ANP, our Advanced Nurse Practice Guidelines, our disaster competencies, our reports on pay, ageing, migration, the work we've been leading in response to the COVID pandemic. We train thousands of people through our leadership programs. But I think people often also don't see the humanitarian support that we offer. Our disaster fund provided money to our nurses in Beirut, in Sri Lanka, in the Bahamas in the last 12 to 18 months in response to the disasters that they've been facing. And we have now supported hundreds of orphaned children in Africa whose parents were nurses and who died from HIV, AIDS, and we support their secondary education. So we impact, yes, at a policy level, but also in practice. And I think that we change lives.
Thanks, Howard. I'm going to go on to the next question. The International Council of Nursing is actually a federation, and that's, I believe, of over 130 different national nursing organisations. So I imagine it's quite a challenge pulling that many organisations together. So can you tell us a little bit about how you ensure there is good governance in the organisation and how you demonstrate that as an organisation?
Yeah, you're absolutely right, Jenny. More than 130 national nursing associations from around the world. We are continuing to grow. Our ultimate governing body is something called the Council of Nursing Representatives. They meet every 2 years for normally up to 3 days. There are the leaders of the elected leaders of 130 national nursing associations and their teams in a room for those 3 days. If you want to see a picture of nursing solidarity in action, if you took a picture of our CNRs, I think that's probably as close as you would get. But what our CNR do, because some people say, yes, they only meet every 2 years, that's true. They then elect the board, who effectively are the agent of the Council of Nursing Representative. The board members are elected from right the way around the world, and they actually serve for a 4-year term. Our board meets twice a year, again for up for three days. Our board has an executive board, the executive members of that board. They meet 4 or 5 times a year in addition to all of those meetings. Plus, we have a number of committees, board committees. I won't go through them all, but things like the constitution and membership. You know, I totaled it up, and our elected members are meeting for at least 40 days, if not more, to provide leadership, member-led leadership to this organisation. And I see our members involved. I'm sure we perhaps talk more about this, but at every stage of our work when we are developing policy and positions.
Thank you.
Just picking up on a bit of that, Howard. So does ICN find that co-production of policy, of guidance really important?
It's central to what we do, Paul. Our strength is in our diversity, where we can bring evidence, learning and experience from right the way around the world. No one country is the font of all knowledge. So it's at the core of how we pull our policy and our positions together. The challenge is that takes time. Reflecting diversity, inclusion, consultation. You can't do that overnight. But that's why, yes, when we were able to meet, there are physical meetings. The Congress, of course, has been the biggest one of those. But there are things like workforce forums. Every year our associations get together just to talk about workforce issues around the world. I saw you had Christine Hancock, both a former General Secretary of RCN, a former President of ICN, talking about her recollections of how RCN benefited from learning from New Zealand, and I happened to be involved in that when I was working for the RCN, and a lot of that learning was through these workforce forums. We do a lot of that now online, of course, as well. We do a lot of it through surveys as well. We do a lot of it with the groups that work with ICN. But we are, as the secretariat, if you like, I lead the secretariat for ICN. We're the servants of our Council of Nursing Representatives and our elected board and members.
Okay, that's great. So as a national nursing organisation, why should we join that federation when we've already got our own little links in our own bit of the world?
ICN, it's not exclusive membership. There are many of our national nursing associations who are also members of, for example, the European Federation of Nurses, the Commonwealth Nurses Federation, other nursing organisations. So they see the value of being ICN members, but also of others as well. The fact that we are the globally recognised body, I think, is hugely important. Nobody else provides that voice, that level of representation, that level of access, and some of the impacts that I've talked about. But our associations, look, we're 100. I said we're 130 and growing. Like RCN, those associations have to make decisions about, is this value for money? What's the impact? Where are the benefits? What do we get out of it? And more than 130 have clearly, by their membership, decided that we tick those boxes. I know a number of our associations from right around the world have written to RCN to express their support for ICN, what they get out of RCN. Your members are, those are the people to listen to about the benefits of ICN, not me. Listen to what the 130 say about how we make an impact globally, how we're recognized as the international voice, how we've pushed for investment in nursing with global leaders right the way around the world, how we've helped to deliver chief nursing officers, greater investment, how we've stood by associations nationally during difficult times in their own country, how we've helped sharing and learning. But I think you might want to talk more about this. You'll hear about how ICN membership for many of those associations also says something about the vision they have for their own organisation and looking to the future.
I think it's interesting what you say about the letters, because I think, yeah, that is fundamental for us as a country, as you know, a national nursing organisation, to understand what the benefits are for us as a national nursing organisation. And I think Council at the RCN publish those letters as part of their papers. So you know, I think it's interesting to we need to make sure those letters are available for members so they can understand what that impact really is. And I think that's something that we need to do moving forward. Thanks, Howard.
And thanks, Howard. And if it's okay, we're going to go on to a little bit about the practicalities of yourselves as a federation. So if you could talk us through a little bit about who can join, but a really hot topic for us is really how much does it cost, but not only how much does it cost us, what is the fee structure of all of those nursing organisations, and how do you ensure that's fair across the world?
Okay, let me try firstly to address the who can join. Just the rider to put out there first. These rules of membership, the constitution, they are decided by the 130 plus national nursing and associations, not by me, not by the staff, but collectively by our members. And those rules, if people want to change them, that's in the hands of the 130 plus national nursing associations. There are two models of membership. A lot of people think that only one association per country can join. In fact, we have a model of membership, an alliance model, where within a country, different nursing organizations can come together to form one organization for the purpose of joining ICN. And we have some members who use that model so that they can bring together all of the nursing interests in their country. We do have some of the very big national nursing associations in membership from countries, but if a country only has a smaller national nursing association that's in membership, other national nursing associations can join. So there can be, in some countries, more than one association, but they happen to be smaller associations. So there are options there that our 130 members have considered to enable as many associations as possible to come forward to join ICN. What about the funding? How does the funding work? The fees are based on basically two criteria. How many members you've got, how many registered nurses are in membership, so your size, but then we look at the country that you're from, and whether it's a wealthy, a high income country, or a low or middle income country. We use the World Bank classifications to do that, so that we adjust the fee dependent on whether your country is considered to be a high, middle, or low income country. And that then determines the fee that you pay. So yes, if you are a large organization from a wealthy country, you will pay more than if you are a small association from a low income country. It's very difficult to find a perfect formula, but our association spend a lot of time to try and find the fairest way to enable people to join, but also to reflect their circumstances. And you know, remember, I see this daily. Many of our associations, they don't have tens of millions of pounds in membership fees that are coming into their organization each year. Some of them are running on incredibly small and tight budgets, and perhaps with no staff or just a part-time member of staff. The other thing then, just to this question of finances, I know some people might think because we're an international organization and we're headquartered in Switzerland that we're an incredibly wealthy organization. we run at ICN on somewhere between 4.5 to 5 million Swiss francs a year. So that's less than £4 million, 3.5 to 4 million pounds, something like that. Yes, we have 130 national nursing associations. People know there are 27 million nurses around the world, but that's the budget. We have about 25 staff as well. So I think in terms of how lean and agile ICN is, people would say, he would say that, wouldn't he? But we are a fit organisation financially in terms of what we do and how we operate.
Okay, thanks for that, Howard. I know, just to push back on the cost, so some of the criticisms we've had is around the American Nursing Association will pay less than the Royal College of Nursing. How can that be with what you've just said then?
Because it would depend on how many members that association has. So it's those two criteria, Paul. So if an association from a country is a high income country, then the fee will be, the individual fee per member will be higher, but the number of members will be lower. But if it is a smaller organization, as I said, a larger organization can then join. One of the other things, though, Paul, that we've introduced, because I know that people then say, well, you know, that does mean that the larger organisations from high-income countries are then paying, you know, an awful lot of the total contribution of fees each year. But to make sure that that doesn't just increase and increase and increase, the board and the CNR introduced a cap of 10% as well, so that no one organisation would pay more than 10% of ICN's fees incomes. I know the RCN fees were heading up to £700,000 plus even a bit more at the point which they left, and again, you know, we provided the figures and members will see them. You know, the estimate that if RCN rejoined, because it depends on the number of members that are declared, but it's we think it's between 380 420,000 pounds a year. So, you know,
and that's registered nurse members, isn't it?
Registered nurse members, absolutely. You know, roughly £1 a year as well. But you know, Paul, this is the other thing for me about some of the more imaginative conversations that we're also having now with other members as well, who say to us, can we partner up with you on a project or on a program? Can we work together on something? And if we say, you know, if we can show how that could be to bring forward something which was genuine benefit to all of our members as well, you know, we can look imaginatively at how we can work on the agendas that are important to individual members, but may also have relevance to the wider membership as well.
Okay, great.
I can ask another question about finance, Howard, just because it's something that's come up in our, you know, we're on social media. We do a lot of talking to RCN members and listening to what they have to say. And one of the questions we're being asked is the only funding for the International Council of Nurses through fees, or do you work with other organisations and companies to have funding on projects or to fund your organisation?
So let me say a bit more about fees and funding as well, because I know that people have also asked for more information on fees and on our accounts. All of our accounts are externally audited by KPMG. All of the documents, all of the information available to our national nursing associations. Our annual report will be out very, very soon as well. And of course, that contains some top line financial information, which is accessible to everybody. Jenny, I think around about 85% of our income is from our member fees. So we are we're very reliant on our members, and there are many people who will say, and I think that this is a really important point, that we should try and be less dependent on member fees income. So that means looking to generate income through other programs and through other projects, and we have done that. ICN has done that successfully. Our leadership programs, GNLI and Leadership for Change, as I said, trained thousands of nurses around the world, funded by the Burdett Trust from the UK, but also Johnson and Johnson. Our TB leadership program, you know, we trained over 2,000 TB nurses. Those 2,000 TB nurses went and trained about 180,000 other healthcare professionals. Yes, that project was supported by Lilly. When we're looking at a project with a partner, we look very, very carefully, of course, that the partner we work with supports the principles of the program and what ICN is trying to achieve. And we go through a rigorous process to make that assessment. But does that mean that we are going to blanket basis exclude working with one sector? Yes, it does, in terms of tobacco, for example. We exclude that, but for pharma or other partners, we will look on a case-by-case basis. And I think there's and I know that this is, people hold different views on this, but when I look around the world, and when I look at how health policy is developing, there is no one sector who has the answers, who has the solutions. Public, private, non-governmental organizations, voluntary, charitable, religious organizations. I see these groups coming together around the world, and our members are involved in many of these sorts of partnerships to advance health care. If you look at the continent of Africa, there is huge investment that we all know which is required. Are the governments solely capable through the public sector to provide that investment? I don't believe they are. I think that it requires the support of a whole range of partners. It's one of the challenging things of working internationally, Jenny. It's complicated. There are different perspectives. There are a whole range of different players, and it's about how you work and bring those people together to move forward. But of course, we are always guided by our core ethical principles, and those are, you know, they're included in our constitution. They're in the our code of ethics as well.
Okay, thanks, Jenny. So, Howard, you've talked a lot about leadership and how ICN and the Council of Nursing Representatives and the board provide that leadership. How do we develop our leaders of the future? So how are nursing students and how are newly registered nurses involved in ICN, and how do they get their voice heard?
Yeah, I know a lot of people think that ICN is some elitist group. It's just for academics, or it's just for top nursing leaders, and we work with a whole range of different nursing groups. I've talked about our advanced nursing practice network and the work that they brought forward. We've worked with nurses in public health, in informatics, ethicists, the code of ethics that I mentioned, and yes, of course, our students. We've had a student network for a number of years, and before our Congress every 2 years, there is a separate assembly for students who last time in Singapore, I think there were 400 or 500 students from around the world who had 2.5 days of discussions of conference, and then they report their issues to the Council of Nursing Representatives, our ultimate leadership body. And the last Congress, our CNR said, and we want to look at going further to develop the input of students, but also younger career professionals in the work of ICN. That means we've just refreshed our leadership group for our student network. Our board are discussing some plans and proposals for what we might do more at their next meeting. Just a couple of weeks' time, the next policy briefing that we're bringing forward will be looking at education and the impact of the pandemic on education. And we've had really important input from students and early career professionals into that work as well. It's not done. We're not at the end of the road, far from it, but it's another area where we are developing, where we are changing, but not because this is what I or the staff are saying we should do, but it's where our members want to take us.
And I think having had the honour of attending a bicentennial one of the events with the Council of Nursing Representatives many years ago, and having spoken out to the student event, it is very active, and the students across the globe are very, very interested in global, or they were at the time, in global activity and how they globally develop the profession as well, which was really reassuring to see at the time.
I think the next question is quite interesting because it leads on from that really, and it's a question that we've been asked quite a lot, hasn't it, Paul, is about the inclusivity of the International Council of Nurses. So one of the things that people have asked us specifically, at the Royal College of Nursing, we include nursing support workers in our membership. And how do the International Council of Nurses do that? But also another question that you've kind of touched on that we feel we should put to you, because it's been put to us quite a lot. In the UK, obviously, we have a banding system, and when you become newly registered, you're a band 5, and it's been directly put to us quite a lot. What does the International Council of Nurses do for band 5 nurses? So I think you've touched on it a little bit, but if you could just talk a little bit about the inclusivity of nursing support workers and the new band 5, specifically band 5 nurses.
The members of ICN, there are different members. Different members have different models, different sorts of organisations. But let me explain like that. Some of them are absolutely focused on the trade union function. Some of them are set up more as professional bodies and colleges. Some, like the college, combine both. Some are regulators. And some of those organisations have members who beyond registered nurses. To join ICN, we need to see that the organisation is led by nurses. It's got the advancement of nursing as its core purpose, and that it is independent as well. It makes its own decisions. Our membership fees are based on registered nurses, and yes, our work is focused on registered nurses. But I think if you look at the publications that we have put out, you will see a really strong recognition of team working, of multidisciplinary team working, and how important that is. And also, ICN works with the International Doctors Association, the dentists, the physios, and the pharmacists as well. There's an alliance of international organisations. So I think people can see how multidisciplinary working is core and at the heart of what we do. The band 5, the band 5 question. Something that I should have said I think probably under the membership issue as well, to be clear. It is not individual members who join ICN, it is their associations. But what those associations say to us I think you'll find some of this in the letters that have been sent as well, that through membership of ICN, they believe they become stronger as associations to represent their members. In terms of the guidance that we produce, clinical guidance that we produce, it is not focused just at experienced or more advanced nurses. It covers all areas of nursing practice and all grades. We regularly, with our members, go out for calls to get clinical experts involved, nursing experts involved in the development of our guidance and our policy, and we are looking for that breadth of experience as well. The work that we've done on workforce, if you look at just in response to the COVID pandemic, what we've been saying about infection rates, about PPE, about mental health impact, about staffing levels, we managed to get staffing levels as part of last year's Patient Safety Day as well. So I think that we can demonstrate how the work of ICN, yes, helps make our associations stronger, but also supports the work of nurses who are in clinical practice.
Okay, thanks, Howard. Earlier on, you talked a lot about the ethics as well and the ethical code, and obviously ICN holds its conferences. So with that strong ethical code that you talked about, how can it be right to hold a conference in Abu Dhabi where the human rights violations are recorded everywhere, and some of the abuse there of people is shocking?
So it's a really important question and decision. The process for determining where ICN goes for its Congress is open to bids. Our associations from around, any of our associations are invited to submit a bid to host a Congress. So that's where the interest initially comes from, is the association in the country. They make a bid, and we have to do a really thorough assessment of each of the bids that come in. That of course includes issues like infrastructure, travel, hotels, all of those sorts of things. But critically, it also is a judgment about how a Congress in a country and a country within a region can help to promote and advance nursing, equality, and rights. And ultimately, when the board make a decision about which bid is successful, they are looking at a range of factors. They consider, of course, the region, its record on rights as well, but also how a Congress could promote, could advance, could move forward those things that all of us may be critical of in terms of a particular country's record. Now, some people then might say, you're having the wool pulled over your eyes. The country might put on a nice show for you because they see the value of having the ICN Congress in their country, but they don't really move. They don't really move on. Just in the last few days, you will have seen, if you looked on social media, the ICN board member for the Eastern Mediterranean and Gulf region, Dr. Fatima Al-Rifai, has been recognized by the United Arab Emirates as one of their 10 or 12 most important people. And the citation is what she has done to develop, to bring forward, to improve nursing. I know that won't satisfy everybody. It's contentious and people hold different views. There are different views within our membership as well. But if we took a view that we would never go to a country where there was a question mark over its record in relation to rights, there would be very few. There would not be
Very
that
few.
many that we would actually be able to consider.
Yeah. Okay. Thank you, Howard. Interesting.
I think I've got the last question here, Howard, before Paul sums up at the end of the interview. But we know that all organisations, wherever we work, whatever we're associated with, have the potential to change and the potential to improve. So I'm wondering what you see as a priority for improvement within the International Council of Nurses.
Yeah. Look, it's a bit of a trick question, because I'm going to give you an answer, but I want to come back again. In many ways, what I think isn't important. It's what our Council of Nursing representatives, it's what our board, it's what our elected members, it's where they want to drive the association forward. So ultimately, our big priorities and objectives for the future, of course, are determined by our members. An area that I do see that we are working on to try and do more of is to build the capacity and the capability of national nursing associations. I think that national nursing associations in many countries have been overlooked and underrated in terms of the contribution that they make. We have, through our COVID work, demonstrated how it's national nursing associations in many countries who've been setting up helplines for nurses, helping the distribution, the manufacturing of PPE, providing mental health guidance as support, who've been at the steering groups, the pandemic response strategy decision-making tables at a national level as well. I think that one of the things through the pandemic has shown the power and the importance of national nursing associations. But I said, many of our associations financially, in terms of infrastructure, are weak and struggle with the lack of recognition of what they do in their country. That's why ICN is regularly asked to go in and to support and work with a national nursing association to help raise its voice, its credibility with decision makers in that country. So that, I think, is something we do. But that's where I also think our associations, our member associations who are more developed, associations I've said who've got no staff or one or two staff. If you're an association who's got 500 to 1,000 staff and significant tens of millions of pounds fees, incomes as well, the potential for that association through ICN to develop, to support, to grow national nursing associations in other countries, I think, is somewhere that we are currently working on doing much more of that. People say, and I think this is so true, it's, and look at the letters as well, it's not just what you get by being an ICN member, it's what you give. And the final point on this, Jenny, I promise, is that, I said something about, I think the ICN membership is also closely tied to the vision that you have for your organisation, nursing in your country, and the future direction. Do you see how relevant and how important do you see global health, global politics, global institutions to what happens in your country? How important do you see developing nursing globally, the support and the investment in nursing globally? How do you feel about supporting nurses who are in much more challenged and difficult places around the world? And this moment that we're at now, the pandemic has shown us that global isn't remote. Global has never been more local. The pandemic will change the world. It will create a reset. We've got a new global nursing strategy coming forward at the World Health Assembly this year. There will be discussions about what new health systems should look like. ICN has been quoted and mentioned by Helen Clark, who's leading that work. We're often mentioned by leaders, including Dr. Tedros from WHO as well. This is a moment where, as well as responding to the pandemic, we are going to be setting a course for future health systems. This next few years, I think, is critical for the vision of health and for nursing right the way around the world. Jenny, Paul, I know you know this, but I believe very, very firmly that now is the time to reunite.
Thank you.
Thank you, Howard. And just to sum up, I think what we've talked about does reflect what the Royal College of Nursing wants now and for the future. And I echo what you say around the pandemic. That really has brought home the need for that global health alliance, that need for that global politics around nursing. What we need to do is work together to develop our workforce, to develop that clinical excellence across the globe, and not work in isolation. And as a UK, we lead in lots of areas, but we also need to learn from other countries in lots of areas, and that is key. And it's key to us as nurses ourselves, as registrants, that patient safety, patient experience, and quality of care is fundamental to all of what we do day in and day out. And I think it was reassuring to hear around your governance, around with the council of the nursing representatives and your board, and how they meet. There was 40 times a year, which was great to hear. But also around that ethical delivery of standards, and that ethical delivery of what ICN does, what it stands for, and that equality and rights, and making sure that everyone has a voice, no matter where they are within the nursing team. I think you're right. Now is the time that we all need to come together. And when the Royal College of Nursing votes on May the 14th, that's also Nurses Week. And it really does show that we can come together and we can make a difference as a global professional workforce. So thank you, Jenny, and thank you, Howard, for your time.
Jenny and Paul, thank you both as well. I think the work that both of you have done just to bring this conversation about international health, about nursing around the world has been hugely valuable. So thank you to both of you for your leadership as well.
Thanks, Howard. Take care.
Bye-bye.